This segment is sponsored by Advanced Pain Care. Living with pain is not the way you want to spend your life. Getting the right treatment to deal with that pain depends on the strength of the evaluation and diagnosis. Dr. Glenn Harper with Advanced Pain Care is here to tell us more about neurosurgery and how it might help. Doctor, good morning to you.
Good morning.
Thank you so much for being with us, Doctor. Lovely to have a neurosurgeon on the program, and I know you've got a busy schedule, so we'll get to the good stuff. Let's talk about what a neurosurgeon does to decide whether or not somebody needs something like spine surgery.
Normally, we're going to start by evaluating our patient and talking to them. Probably the most important thing we do is find out a little bit about the patient's history, how their pain started and what's developed over time, and maybe what they've done for their pain before they've come to see us. And then we want a good description of the pain. Where does it affect their back or their neck, and does it radiate to other places, things like that. Once we do that, we're going to do a physical examination, and during the exam, we are looking for specific signs that may help us decide what the diagnosis might be, which is really the most important thing we can do, is find a diagnosis. After we do that, we're going to look at all the imaging. That becomes the last part of what we need to do to try and figure out if it all adds up. And what we find is that the more that things add up, the better the chance that we can do something to help. So that sort of answers the first part of the question, which is, could a surgery help? But then we need to ask the second part of the question, should we be doing surgery? And for that, we're going to look at things like the patient's past medical history. Maybe they have some heart disease or things like that that might prevent us from doing surgery. Or maybe they have things like bad osteoporosis or uncontrolled diabetes. So we want to add all these factors together to really decide whether surgery is right for any patient.
You say you hear this all the time, kind of people talking about spine surgeries that didn't seem to work for them. Why do we hear so much of that colloquially?
It's true, some spine surgery doesn't work. I would say there's really kind of a number of different reasons why it might not work. And it really starts out with how complex the spine is. You know, just the anatomy of the spine, there's 7 bones in the neck, 12 in the mid-back, and 5 at the bottom. They all connect through these really complex 3-part joints. And so there's so many things that can go wrong. As we look at the MRI after evaluating the patient, we're trying to assess what may be the cause. And when we get close and people have failed everything else, then maybe we're going to try a surgery, but there's no guarantee it's going to work. That's not to mention that also pain can come from other things outside of the spine, like the muscles and ligaments and tendons, which we can't treat surgically. So there's a whole lot of that. A second part of it is that people can continue to have degeneration. Just because we treat one part doesn't mean something else couldn't happen or something happened to that same level. And then the final thing I would say, patients may not always understand the goal of the surgery. Probably the best example I see of that is when a patient has spinal cord compression. And my goal in the surgery is going to be to try and keep them functional, but maybe they come into the surgery thinking that I'm trying to treat their pain. And so they feel like the surgery is a failure, even though we've accomplished the goal that the surgery can attain.
Let's talk about any alternatives to major spine surgery, because I think a lot of people are afraid of going, for lack of a better term, under the knife.
The vast majority of people with back or neck pain are not going to need surgery. And some start by seeing me or another neurosurgeon first, but many times there's other things they do. When I'm talking to patients, I tell them there's really 4 categories. And the first category is kind of doing nothing or resting and maybe taking over-the-counter medications. And then we move into what I call the non-invasive options, and those include things like physical therapy, anti-inflammatories. People also try things like chiropractic and acupuncture, Reiki therapy, the list goes on and on. The third option then is the things that our pain management physicians do, like injections, sometimes with some a little bit stronger pain medications as well. The fourth option is really going to be the surgical options. Kind of between the third and fourth option is another one that we really think about a lot, and that's the spinal cord stimulator. This is an implant that has little wires that sit over the spinal cord and help interrupt that pain signal so that it never gets to the brain. It's a really minimally invasive option that has been around for about 35, 40 years, but just in the last 10 years, it really treats a lot more pain than it used to in the past.
That's incredible. So it makes me want to touch on the fact that you guys really tackle a lot as far as pain is concerned, but also you've got a wide range of things that you treat as far as advanced pain care goes. So can you talk to me a little bit more about neurosurgery itself?
The neurosurgery aspect, we really focus on kind of the most minimal that we can do to help patients through pain, but it's not just neurosurgery that's there and pain management. We have orthopedic surgery there that can do an awful lot of things for patients. We have neurology there. Our neurologist not only treats pain-related things like headache, but does some general neurology, a lot of general neurology, and does a lot of testing that helps us decide what else we can treat. We have rheumatology there. We have a pharmacy there, so patients can get not just their pain prescriptions, but all their prescriptions filled we have quite a number of providers that can help in a lot of different areas.
Doctor, thank you so much for the education this morning. We appreciate your time.
Thank you so much.
To learn more about what you could do if pain wasn't holding you back, talk to the doctors at Advanced Pain Care. Go to austinpaindoctor.com to get help managing your pain today. This segment is sponsored by Advanced Pain Care.